how to treat shoulder pain. For instance, I'll demonstrate how easy it is to alleviate shoulder pain using the free video, How to Treat Pain with Acupressure. In this video, at 2 minutes and 28 seconds, I reach the Where Does It Hurt section and proceed to the shoulder pain segment. Here, you'll find areas of different colors showing the meridians involved based on the location of the pain. Since the image rotates, you can move forward and backward in the video to clearly see the area where you're experiencing pain. It's possible that our painful area is larger than just one color zone. This is normal because often pain, being an external aggression, can spread horizontally to adjacent areas. In this case, we need to address the 2 or 3 meridians involved, one after the other. In our example, let's say I'm feeling pain here. I check if it's the right area by touching further down along the meridian, let's say towards the forearm, to see if this area is also painful to the touch. This forearm area probably won't be as painful as the first, but it should still be uncomfortable and resonate somewhat with the shoulder area. Once we've identified the meridian involved, we move to the first minute of the video where all the video timestamps are located. In our example, it's a pain in the right large intestine and the 3 right heaters. Obviously, consulting the first minute, we're instructed to go, for the large intestine, at 10 minutes 21 exactly for the 3 heaters. If we're familiar with the large intestine, we ignore the meaning of the 3 heaters. This refers to an energetic system that absorbs energy from food and air, and is also related to the nervous system. So we go to 10 minutes 21. I'll fast forward a bit. The first thing presented to us is points to address before treatment if we have a particular affection related to this meridian. In this case, it's talking about elbow pain. Depending on whether that's our case, we stimulate these points immediately. Remember, always stimulate the points on both sides of the body. This is an extraordinary vessel, as explained in the book. It's a particular situation where the body, to protect itself, redirects excess energy into a normally empty parallel channel. If that's the case, we recognize it by certain specific symptoms appearing, in this case, elbow pain. If that's not your case, you skip it and continue the video. The next 3 points are for preventing the pain we want to treat from deepening or shifting to another meridian during the treatment, as explained in the book. Pain, if it's not lesioned, is always an external energy aggression. The body itself generates this pain by blocking the circulation of surface energy to preserve deeper systems. The mechanics of this whole course are about dispersing the invasion and restoring the body's normal circulation, which alleviates pain. We have to understand that for the body, it's the deep systems, the ones that sustain life, that are the most important. Currently, we're treating a tendinomuscular condition, which means this treatment is effective for pain of less than 45 days and non-lesional. If the 45-day deadline has passed and the pain persists, we're dealing with an invasion that has reached the 2nd depth level, and in this situation, tendinomuscular treatments are not effective. The pain itself has become intermittent, appearing and disappearing now and then. It can even be triggered by meteorological situations, like people sensing the rain coming, among other factors. Ultimately, if it progresses to the final and 3rd depth stage, we're dealing with pain on the main meridian, and in this case, this pain can interfere with normal body functioning. In this case, the work is much longer, and we need to use the therapeutic recommendations provided in the therapeutic index. One thing to note: if you've enrolled in the course and find the points presented in the therapeutic index not clear enough, remember that you have access to 14 videos showing all the meridian points more clearly. So let's go back to our subject. Once we've done the 3 points, the first 2 being always the same for all meridians, and the last one always a point on the fingertips or toes, we move on to the second step of 4. As with the first step, we stimulate in tonification, that is, by turning clockwise. In tonification, we attract energy. In dispersion, we move it away. Since in the first step, we wanted to close the points, in this case, the points of exit, we tonify them. The second step involves tonifying the meridian strengths as well. The peculiarity is that the point we need to stimulate is variable depending on the season. This is because your body's energy doesn't always behave the same depending on the season. It's a bit like the sap of trees. While in spring, it rises. In autumn, it descends, and in winter, it sleeps in the roots. Your meridian's energy also has its cycles, and the points for tonifying or dispersing change accordingly. Your treatment will thus differ from one season to another, at least for these points. Check the points presented, and depending on the climate, find the corresponding point. You'll notice that there are 5 seasons. The reason is that energy returns to the center before moving on to the next season. We call this the intercession, which relates to the earth element, meaning the stomach and pancreas spleen. It's also the system we work on in the new growth program to bring vitality to the breasts to help their growth. Check our website if you're looking for a natural alternative to surgery. Once we've stimulated in a clockwise direction the points of the seasons, we can move on to the third step. Don't forget, as mentioned earlier, to treat both sides of the body thoroughly. The third step is the most important, but in this case, we stimulate counterclockwise because we're dispersing excess energy. That is, the energy that has been added to normal energy. We start with the highest point of the meridian because we're dispersing it. In the case of the large intestine meridian, which is a medium-sized meridian, we're talking about point number 20. There's a meridian with 67 points, which is the longest, called bladder, which runs along the back. There are also shorter ones with 9 or 11 points, so we follow the path shown in the video. From the neck to the index, passing through the painful area, of course. As noted, we take care to go more slowly and spend more time on the more painful areas, whether pressing with our hands or with an acupuncture pen. After closing the door, increasing resistance, we attack the external energy to disperse it. The last point is to close the borders and sign peace. That is, we restore integrity to the affected meridians. If you're also dealing with one or more meridians that were painful, repeat the same steps with the next video. Normally, if we're not dealing with a lesion and we've properly diagnosed the meridians involved and done the work well, we should get relief of 50 to 80% in 20 to 30 minutes after treatment. You can repeat the treatment as often as you like in the same day. Just allow a few hours for the previous treatment to finish its work. I hope these explanations have helped you better understand how to use this training. Don't hesitate to contact me if you need further clarification or have any questions.